Have you ever noticed that on some days, a minor annoyance like, say, plucking a stray eyebrow hair?
Oh, or getting a deep tissue massage.
Yes, exactly.
Yeah.
You do it, and it just feels like a slight pinch or a good stretch.
Right. No big deal at all.
But then, maybe, I don't know, 2 weeks later, you go to do that exact same thing, and it is completely excruciating.
Yeah, you're wincing, your eyes are watering.
And you are just sitting there wondering if your pain tolerance somehow vanished overnight. Well, to everyone listening, you are not imagining it.
You really aren't.
Today we are going to a deep dive on some really fascinating clinical data that proves your pain tolerance actually does physically vanish at specific times of the month.
Yeah, and more importantly, we're going to explore how you can use that data to, well, essentially biohack your next medical procedure.
Exactly. The mission for today's deep dive is to look through this wild stack of sources we've gathered.
It's a pretty eclectic mix today. I mean, we're pulling from a few different fields.
Yeah, we have detailed clinical breakdowns of the nervous system's response to the menstrual cycle.
Right, and then we have this incredible pilot study using electrical shocks to map pain perception.
Which is wild.
Hmm.
And we're pairing all that with actual clinical guidelines for vaginal rejuvenation lasers.
I know it sounds like a jump, but I promise the connection there is super clear once we get into it.
So the immediate question for anyone listening is, well, why would pain fluctuate based on the calendar at all?
Right.
Like, it's one thing to have localized cramps, but it's a completely different thing to say your eyebrow hurts more on a Tuesday than a Thursday.
Yeah, that sounds like superstition until you look at the biology.
Exactly. So to understand that, we have to look at what the hormones driving the menstrual cycle are actually doing to the central nervous system.
It requires looking at the cycle as a whole body rhythm, not just a reproductive timer.
Right.
The cycle is driven by this constant ebb and flow of hormones. Primarily, we're talking about estrogen and progesterone, and they move across 4 phases.
Okay, so let's break those phases down real quick.
Sure. So you have the menstrual phase, which is when bleeding occurs. Then the follicular phase, where the body is building the new lining.
Right.
Then ovulation, releasing the egg. And finally, the luteal phase, which is the post-ovulation wind down.
So reading through the neuroendocrinology data in our sources, what really stood out to me was how estrogen functions during those follicular and ovulatory phases.
It's amazing, right?
It is, because when estrogen levels are climbing and hitting their peak, it doesn't just stay in the reproductive system.
No, not at all.
It is actively circulating and acting as this massive systemic pain buffer
Yeah.
for the whole body.
Yeah, the mechanism there is honestly incredible. So estrogen actually crosses the blood-brain barrier.
Wow.
And once it does that, it interacts heavily with the brain's serotonin receptors. It promotes a sense of well-being, sure, but it also actively dampens systemic inflammation.
Okay.
So it's physically regulating the way your sensory neurons fire.
It makes me think of estrogen as like a pair of high-end noise-canceling headphones for your nervous system.
Oh, I love that analogy. That is spot on.
Right. So during that follicular phase, the headphones are fully charged, they're turned on,
Yep.
and you can hit a physical pothole, like a tough workout or a waxing appointment, or that deep massage.
And the headphones just filter out.
Exactly. They filter out the background noise of that minor tissue damage, so it barely registers in your brain as pain.
That hits on the neurology perfectly. Because when the cycle shifts into the late luteal and menstrual phases, well, estrogen levels just fall off a cliff.
The headphones come off.
Exactly. Suddenly, the background noise of your body becomes absolutely deafening.
Wow.
But the nervous system isn't just dealing with a lack of estrogen. It's also being flooded with these compounds called prostaglandins.
Okay, prostaglandins. They always come up in discussions about period cramps.
Right, they're the usual suspects.
They are the chemical messengers that trigger the uterine muscles to contract, which is what physically causes the cramping sensation.
Right, they cause the muscle spasms.
But what are they actually doing to the nerves to make things hurt more,
Yeah.
like globally across the body?
Well, so prostaglandins are essentially lipid compounds. The body naturally produces them at sites of tissue damage or infection to deal with injury.
Okay.
But in this case, the body is producing a ton of them to help shed the uterine lining. The problem is they leak into the bloodstream.
Oh, so they don't just stay in the pelvis.
No, they travel.
Oh.
And when they reach your nerve endings elsewhere, they literally change the voltage threshold of your nociceptors.
Nociceptors being your pain-sensing nerves.
Yes. They sensitize the nerve endings so that it takes significantly less physical pressure or heat to trigger a pain signal to the brain.
So, just to make sure I have this right, If a nerve in your back normally needs, say, 10 units of pressure to tell your brain, ouch,
Right.
the prostaglandins lower that threshold to maybe 3 units of pressure.
Exactly. So a light touch suddenly feels like a heavy blow.
That is wild.
And the brain imaging data from our sources takes that a step further. We're looking at data from groups like Samphire Neuroscience and Vitru Health.
Yeah, the fMRI scans.
Right. The functional MRI scans show that the pain processing centers of the brain itself are measurably more reactive before and during menstruation.
So the brain is actually lighting up differently.
Yes. The brain is interpreting incoming signals much more aggressively, based purely on the hormonal phase.
But okay, estrogen fluctuating is just a chemical theory, right?
Yeah.
I mean, if the noise-canceling headphone analogy is true, and the brain is actually this hyper-reactive,
Yeah.
we should be able to measure someone's pain tolerance dropping in real time. Has anyone ever actually hooked people up to a machine to test this in a controlled environment?
They have. A clinical study published in the journal Healthcare did exactly that.
Okay, let's get into this study.
So they took a group of 34 physically active women with regular menstrual cycles, and they used a 10NS unit to map their pain thresholds.
And a 10S unit transcutaneous electrical nerve stimulation. That is basically a small machine that delivers controlled electrical shocks through sticky pads placed on the skin.
Right. Usually used for physical therapy, but here they used it as a testing device.
Right.
The researchers used a dial to slowly turn up the electrical current to measure two very specific physiological markers.
The set and the peak, right?
Exactly. The sensory electrical threshold, or SET, and the pain electrical threshold, or PEAT.
So the set is like the exact millivolt where you first perceive a tickle.
Yeah, the moment you say, okay, I feel the electricity.
Right. And the peak is the exact moment you tell the researcher to stop because that ticklish feeling has crossed the line into actual sharp pain.
Precisely. And they tracked these women across 5 distinct phases of their cycle to see if those numbers moved.
And what happened?
The data showed a drastic plunge. During the premenstrual and menstrual phases, both the sensory threshold and the pain threshold were significantly lower than at any other time in the month. It took a fraction of the electrical current to cause the women to report active pain.
So they were objectively, measurably more sensitive to physical trauma.
Yes, the numbers proved it.
See, I was reading through the methodology of that study and something jumped out at me.
What was that?
We were talking about period pain. So you would assume they put the shock pads on the lower abdomen, right?
Right, which they did.
They did. But they also put a set of shock pads on the women's forearms.
Yeah, they did.
Why are they testing arm pain in a menstrual study? Does this mean women actually experience pain differently in their arms?
That forearm test is arguably the most important finding in the entire study.
Really? Why?
Well, the researchers divided the 34 women into 2 groups, a control group with normal, mild cycles, and a group suffering from primary dysmenorrhea.
Or PD.
Right.
And just to clarify for everyone listening, primary dysmenorrhea is the clinical diagnosis for debilitating, severe period cramps that aren't caused by a secondary disease like endometriosis.
Exactly. It's just severe functional pain.
Okay, so what happened with the PD group?
The women with PD didn't just report higher pain on their abdomens during their periods. They had consistently higher pain perception across almost their entire cycle.
Wait, all month long?
Almost, except for the follicular phase. And the crazy part is they felt this heightened, severe pain sensitivity in their forearms, too.
That is wild. The fact that the uterus cramping severely every month physically alters how much a shock to your arm hurts.
I know, it sounds like science fiction.
It implies the whole system is being rewired.
It does. It highlights a physiological process known as central sensitization.
Central sensitization. Okay, explain that.
Because the women with PD are enduring repeated, severe inflammatory pain month after month, their central nervous system adapts.
Oh, I see.
The master volume dial for the entire body basically gets turned up permanently.
To protect them.
Yes. The neural pathways become hyper-responsive to protect the body from what it thinks is constant danger. So the pain is no longer localized to the pelvis. The entire central nervous system becomes highly reactive to any nociceptive stimulus, whether it's on the stomach, the arm, or anywhere else.
So for a listener dealing with severe period pain, it's not just a few bad days.
Not at all.
Your nervous system is essentially living on high alert almost all month long, except for that one sweet spot in the follicular phase.
Right, when your estrogen finally rises high enough to buffer the system.
Which brings up a highly practical question.
Go for it.
If we have clinical proof that pain sensitivity peaks globally right before and during a period, and that the nervous system is highly reactive,
Yeah.
How does the medical field handle scheduling elective procedures that actually hurt?
That is exactly where our sources transition from biological theory to actual clinical practice,
Right, we dive into the field of cosmetic gynecology and vaginal rejuvenation.
which is a massive industry right now.
It is. We looked at clinical guidelines for devices like the MonaLisa Touch and FemTouch, which are CO2 lasers, and radiofrequency devices like Votiva or Thermiva.
Right. Now, looking at the literature, these devices were actually initially developed to treat genitourinary syndrome of menopause, or GSM,
Okay.
because when women hit menopause, their natural estrogen levels plummet permanently.
Right.
And that leads to vaginal atrophy, severe dryness, laxity, and just a host of quality of life issues.
But wait, let's address the elephant in the room here. We are talking about scheduling treatments around the menstrual cycle.
Yeah,
Menopausal women, by definition, do not have menstrual cycles.
true.
So why are these clinics issuing strict period tracking protocols for this machinery?
It's because the demographic for these treatments has vastly expanded over the last few years.
Oh, I see.
While the technology was pioneered for menopausal atrophy, clinics now heavily utilize these exact same lasers and radiofrequency devices for postpartum recovery, treating laxity after childbirth, and even preventative care in much younger women.
Ah, okay. So these are patients who absolutely still have active, regular menstrual cycles.
Exactly, and a lot of them.
And these med spas and clinics market these treatments as like lunch break procedures.
Oh yeah, they call them non-invasive, quick, and explicitly painless.
But when you look at the mechanical engineering and the clinical sources, calling them painless seems biologically impossible.
It really does.
You are delivering high-intensity thermal energy directly into sensitive mucosal tissue.
Right. The medical literature describes the mechanism as delivering microscopic columns of controlled thermal injury.
Thermal injury. That doesn't sound painless.
No. You aren't cutting with a scalpel, but you are absolutely inflicting a calculated burn.
My analogy for this is aerating a lawn.
Okay, I can see where you're going with this.
If your lawn is compacted, you rent a machine that punches hundreds of tiny holes deep into the dirt.
Right, it looks terrible for a few days.
It looks incredibly destructive in the moment,
Mm.
but causing that controlled microscopic damage is what breaks up the tension.
Exactly.
It stimulates the roots, brings in oxygen, and forces fresh, healthy grass to grow. So these lasers are essentially aerating the vaginal walls.
That is a brilliant way to put it. The thermal injury is the entire point of the procedure.
Right.
Inflicting those microscopic burns is what triggers the body's natural wound healing cascade.
Because the body rushes to fix the burn.
Yes. The trauma signals fibroblasts to rush to the area, which kickstarts neocollagenesis.
Which is the production of brand new collagen.
Right. Along with fresh elastin and new blood vessels, it plumps and rehydrates the tissue.
But to get that amazing healing response, you first have to endure a machine burning microscopic holes into your tissue.
And that is the catch.
Right. If you are going to intentionally injure a highly sensitive area of the body, you need your pain tolerance to be absolutely maxed out.
Exactly. Enduring that thermal injury comfortably requires taking every biological advantage you have.
And this is where the 10NS unit's study on electrical pain thresholds collides perfectly with the modern clinical protocols.
It really is a perfect overlap.
Because the clinics know exactly when a woman's nervous system is most vulnerable, and they schedule accordingly.
They absolutely do.
When we looked at the explicit patient instructions provided by these clinics, the rules were remarkably rigid.
Oh, very strict.
The protocols for the Votiva radiofrequency device plainly state, women should not be on their menstrual cycle when treatment is performed.
Right. And another source we looked at, Heron Med Spa, which uses the Thermiva device, tells patients they must schedule their appointment specifically 7 days after your menstrual cycle.
Which is so specific. And adding another layer to those protocols, Votiva explicitly instructs patients to stop using all NSAIDs, so non-steroidal anti-inflammatory drugs like ibuprofen or Aleve,
Right.
3 days prior to walking into the clinic.
Now, this is where you really have to do some detective work as a patient.
Why is that?
Because the clinics don't always explain the why to you. They might just say avoiding the period is for hygiene or to avoid messy bleeding.
Right, they frame it as a convenience thing.
Exactly. But when you look at the biology, it is a highly calculated biohack.
So let's trace the biological steps of what happens if a patient ignores the rules and tries to get this laser treatment on, say, day 2 of their period.
Okay, let's play that out.
First, they are banned from taking NSAIDs.
Right.
We know NSAIDs block prostaglandins, but they also thin the blood. If a clinic is firing a laser into your tissue, they don't want you on blood thinners because it drastically increases the risk of bruising and bleeding.
Makes perfect clinical sense.
So the patient is completely unmedicated.
And because they can't take NSAIDs, their body is absolutely flooded with those unblocked prostaglandins.
The pain amplifier.
Right. As we discussed earlier, those lipids are actively circulating, lowering the voltage threshold of the nociceptors in their pelvic region.
Wow.
So every nerve ending is hypersensitive and ready to fire at the slightest provocation.
On top of that, it's day 2 of the cycle, meaning systemic estrogen is essentially at 0.
The noise-canceling headphones are completely off.
Exactly. The brain's pain processing centers are glowing on an MRI, hyperreactive to any incoming signal.
It's the worst possible time.
Right. If you apply a microscopic thermal burn to that tissue at that exact moment, a procedure that is supposed to be a comfortable warming sensation is going to feel like absolute torture.
It would be excruciating. But look at the physiology. If the patient follows the clinic's advice and waits exactly 7 days after their period ends.
Okay, so 7 days post-period puts them squarely in the middle of the follicular phase.
Right, and the biological environment is completely transformed by then.
How so?
Well, prostaglandin production has ceased, so the systemic inflammation is gone.
Okay, so the pain amplifiers are cleared out.
Exactly. And more importantly, estrogen production is skyrocketing, pushing past the blood-brain barrier and acting as a powerful neurological buffer.
Ah, so the nervous system is heavily shielded.
The noise-canceling headphones are on maximum volume.
I love that.
And because of that estrogen peak, blood flow to the tissue is optimized. The fibroblasts are primed to respond to injury efficiently. So the clinic isn't just trying to avoid a messy procedure, you know. They are utilizing neuroendocrinology to ensure the patient's body can endure the physical trauma of the laser without the central nervous system registering it as severe pain.
They are aligning the trauma with the exact moment the body is biologically equipped to heal from it.
It's brilliant.
It is genuinely fascinating that med spas are quietly leveraging this complex hormonal data to ensure their Yelp reviews say it didn't hurt a bit. Highly recommend.
Right. It completely recontextualizes what a menstrual cycle actually is.
It really does.
Yeah.
To you, listening right now,
Mm-hmm.
if you have a cycle, it is so much more than just a reproductive timeline.
Absolutely.
It is a monthly, predictable, systemic rhythm of your entire nervous system.
And tracking the phases of that cycle isn't just about fertility planning. It is a legitimate, highly effective biohacking tool.
Yeah, you can use this knowledge to schedule your life.
If you really can.
If you know you have a biological pain buffer built into your body during the follicular phase, you can time an intense laser treatment, a difficult waxing appointment, or even a personal record weightlifting session for when your body is essentially wearing neurological armor.
And conversely, you know, to go easy on yourself during the late luteal phase when the armor is gone.
Right. Understanding your own biology provides such a massive advantage.
It really does. But, you know, looking at all of this data, seeing how dramatically these hormonal phases alter our sensory and electrical pain thresholds,
Yeah.
it raises a very provocative question about modern medicine as a whole.
Oh, where does this lead us?
Well, think about it. If the clinical data is this definitive, if we know that the nervous system is globally hyperreactive on day 28 and incredibly resilient and primed for healing on day 10, why is this biohack mostly limited to cosmetic gynecology?
That is a really good question.
Right. Should the broader medical field be timing all elective procedures around the menstrual cycle?
That is an incredible point to ponder. I mean, think about getting a cavity filled at the dentist, or sitting for a 4-hour tattoo, or even scheduling an elective orthopedic surgery like an ACL repair.
Exactly. If a patient has the luxury of choosing the date for a painful procedure or surgery, why wouldn't the medical establishment actively leverage the follicular phase?
Wow.
We could be minimizing acute pain, reducing the need for post-operative painkillers, and maximizing the tissue's natural healing cascade for almost everything we do, simply by looking at a calendar.
Why schedule a root canal on a day when your natural pain buffer is completely gone, when you could wait a week and have your body do half the heavy lifting for the anesthesia?
Exactly. It completely rethinks how we should interact with our own healthcare.
It really does. So the next time you are booking an appointment, whether it's for a medical laser, a tattoo, or just deciding which week to pluck your eyebrows, maybe take a quick look at where you are in your cycle first.
Couldn't agree more.
Because when it comes to pain, timing really is everything.